last two meetings, actually.
No Daryl today. I thought I saw Brian's car outside. I was here to create kind of.
How about now?
And there's Fern. Look at that. Fantastic. Sticking with our 9:02 start time.
Can you try logging out, Sarah? About 8:45.
You all set?
Yep.
All right,
If it doesn't
fantastic.
work, it doesn't work.
I'm going to call this meeting to order here at 9:02 in the morning. If you'd all join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, the republic for which it stands, one nation, under God, indivisible. Thank you. Opening ceremonies, the invocation this meeting is for Commissioner Henschel.
Thank you, Mr. Chairman. First, I'd like to remind all of us why we're here. Right at the top of the agenda is the mission statement of Grand Traverse County. Grand Traverse County is committed to being a leader in providing responsive, effective, quality service to our community. And I hope our meeting will reflect that, and I hope my actions will as well. For our invocation, I have a classic today, so if you'll reflect upon with me the prayer of St. Francis. Let us bow. Lord, make me an instrument of your peace. Where there is hatred, let me sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. Where there is sadness, joy. O divine Master, grant that I may not so much seek to be consoled as to console, to be understood as to understand, to be loved as to love. For it is in giving that we receive, it is in pardoning that we are pardoned, and it is in dying that we are born to eternal life. Amen. Thank you.
Amen. All righty. Clerk Shealy, roll call, if you please.
Walter?
Here.
Spence?
Here.
Nelson? Morris?
Here.
McAllister?
Here.
Henschel?
I'm here.
Flynn?
Here.
Andrews?
Here.
Seifert?
Here. Moving right along, first public comment, again, if you please. Hold on a second, Miss, she's going to read
Any
the rules.
person shall be permitted to address a meeting of the Board of Commissioners which is required to be open to the public under the provisions of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board may state his or her name and township or district. Providing a specific address is not recommended. Persons may address the board on matters or issues which are relevant and germane to county government as determined by the chairperson. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioners' questions, if any. The chairperson shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chairperson may, at his or her discretion, allow an additional opportunity or time to speak if determined germane and necessary to the discussion. Public comment will be solicited during the 2 public comment periods noted in Rule 5.4 Order of Business. However, public comment may be received during the meeting when a specific agenda topic is scheduled for discussion by the board. Prior to the first public comment, the chairperson will indicate the topics on the agenda for which public comment will be accepted. Members of the public wishing to comment should raise their hand in order to be recognized and shall not address the board until called upon by the chairperson. The board shall not comment or respond to a person who is addressing the board. Silence or non-response from the board should not be interpreted as disinterest or disagreement by the board. Please be respectful and refrain from personal or political attacks.
Thank you. Please go to the podium. Anybody else, more than welcome to form a line behind her. Thank you very much.
Sorry, I wasn't trying to jump the gun there. Anyway, good morning. My name is Barb Smith. I'm a resident of Garfield Township and, of course, Grand Traverse County. I come to you today to just share with you some serious concerns, offer you my thanks for your service, and to leave you with a couple asks. So greetings to everybody here from our community. My concerns, I'm concerned that many in public office, though I've not seen it here, have forgotten they were elected to serve, not rule, not occupy, and certainly not conquer. I speak urgently of the current administration in Washington, although others too suffer this loss of memory and morality. Great harm is currently being wrought on individuals, communities, states, our country, and the entire world. This is being directed by a self-serving president and implemented by his enablers, by oath breakers, and by all who sit silently complicit. Day by day, we are becoming poorer as our country's assets are being stripped for the benefit of a few. We are becoming sicker as science and medical professionals are ignored. We are becoming less safe as our neighbors and allies are threatened by this current government. Our Constitution is being replaced by cruel expediency, the rule of law quashed by quotas, and our liberty shredded by surveillance and thugs. So why do I come to you today to speak? This governmental body sits close to the people it serves. I believe you have the unique opportunity to listen and work directly with us, which is why I came. I'm asking you to please take these concerns seriously, to acknowledge them, and to do what you can to mitigate them. I don't just come with concerns today, I also come to thank you for serving. Because we work together as a community, it's for the benefit of all. I do urge you to always remember to prioritize things like honesty, fairness, justice, liberty, and respect for everyone on our planet. I ask you to continue to stand for our community and all of its members, whether they're citizens or not. Most in this room, and indeed in this country, are here because our families immigrated here. Immigrants have helped this country grow and continue to deserve the same chances and welcome that our ancestors were given. A specific ask would be, I ask you to deny approval of any 287G agreement with ICE if one is offered. Generally, I will ask you to work for the benefit of all in our community. Our best way forward is together. Thank you for hearing my comments today.
Thank you for speaking today. Would anybody else like to go to the podium for public comment? Going once, going twice, 3 times. All right, thank you very much. Approve of the agenda. I will make the motion. We approve the, wait a minute, what did I miss there? I do. I'm going to make the motion. We approve the agenda with the addition under 6A. Linda Zeller is here, the new CEO of Northern Lakes CMH. There you are. She's going to speak, introduce herself, and give some words. Looking for a second.
Support.
All right, have support by Commissioner Henschel. Discussion? All those in favor say aye. Aye. All those opposed say nay. Thank you, everyone. Thank you, Nate. No, you're 100%, man. Thank you. Consent calendar.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file, or approval, is approved by a single commission action adopting the consent calendar. A, receive. Number 1, Safe Harbor Shelter Utilization Report, December 2025. Number 2, Expenditure Report. Number 3, ARPA Status Report. B, approvals. Adoption of the Board of Commissioner minutes. Number 2, Health Department Deputy Medical Examiner Appointment Update. Number 3, Remonumentation Grant Administrator. Number 4, Fiscal Year 2025 Annual Report, Northwest Michigan Supportive Housing. Number 5, Law Enforcement Center Rooftop Unit Replacement included in CIP. Number 6, GFC Agreement for Justice Facility Advisory Committee Facilitation Services. Number 7, Traverse City Cost Sharing Offer for Joint Plant Moran Real Point Services. Number 8, American Heart Month Proclamation 2026.
Thank you. Would anyone like to have anything pulled from the consent calendar? Commissioner Walter.
The minutes.
What is that, B1?
B1, sorry.
You're okay. Anything else? Anyone? All right, seeing that, Commissioner Henschel?
Mr. Chairman, I move to approve the consent calendar with the exception of B1.
I'll support that.
Fantastic. We have a motion by Commissioner Henschel, support Commissioner Spence. We support the consent calendar with the exception of B1. Can we have a roll call vote, please? Any further discussion on that? Sorry. Roll call vote, please, Ms. Shealy?
Spence?
Yes.
Nelson? Oops, sorry, he's not here. Morris?
Yes.
McAllister?
Yes.
Henschel?
Yes.
Glenn?
Yes.
Andrews?
Yes.
Walter?
Yes.
Seifert?
Yes. Thank you. Now we're going to go on to special orders of business 6A. Stella, this is your turn.
So if I could say something while we're waiting for Linda to make her way to the podium.
Please do.
I am really super excited that Linda's here with us today. This has been years in the making. And I think I told you guys, or a previous board, that at one point, Northern Lakes Community Mental Health was going to become an organization that our community could be proud of and rely on. I think that day is here. Linda has come right in, hit the ground running, and she's a problem solver, and she is a bridge builder, and I'm excited for the direction that we're going in. Hi, Linda, take it away.
Thank you, Commissioner Morris. Honored to also have the commissioner on our board playing critical roles as well. So I am Linda Zeller. I grew up in Wisconsin, but have been in Michigan ever since. The foundation of my career is county and local work in behavioral health, all the way from in the early years. My husband and I actually ran homes where people were coming right out of the institution, living there. So the foundation of my years is community mental health and wellness based. In the middle, I did a whole bunch of state and federal policy level work in health and behavioral health, including in Michigan's correction system, as well as the state behavioral health administrator. So it feels really good to return to local service. I'm very excited about that. I think the 6 counties here together, Northern Lakes as an agency, has a whole lot of positives within it and has had a struggle. Many self-imposed, I believe, and many that are struggles state and nationally, that we have to work through. And not, I'm sorry, and items that are common to everyone nationally that are very local. So when I read and watched and learned what some of the challenges have been in our communities, what came out to me very clearly is that transparency, communication, and accountability is absolutely key. The enabling agreements between the counties makes that clear. So in my first 3 months, I asked my board members if they would make introductions to board chairs at the commissions, county administrators, and so that I could sort of do the rounds, getting to know people and beginning a dialogue. Community behavioral health and wellness cannot just be done by Northern Lakes. We need all of our partners, and we have had some serious struggles. We've had a downward trend of 2 years of cash flow, 2 solid years where our assets have gone down. Due to the hard work of the prior interim CEO, Dr. Kurt Cummins, that problem was leveled in July. Really amazing actions taken by that leadership and the board at that time, so things have leveled. And yet, I want to be clear and transparent that we are steady, but we need to work hard with our community to bring Northern Lakes back to an organization that can do more beyond what Medicaid can do, right? Right now, we are really driven by entitlements and what Medicaid can do. Our flexible funding, our general fund is a total of $3 million. Last year, we expended $6 million. So how did we do that? We actually cashed out all investments. So I'm just trying to be very, very transparent, because in order for us to start conversations about what can we do together during this time of rebuilding, we have to be very clear about what we have and what we don't have. This is not I am not pessimistic. I am super optimistic about this organization and what we can do together. Without exception, I have been welcomed, and people have been very straight with me about what the challenges are. The interface of justice systems and behavioral health are a huge priority, and most of that is dependent on flexible funding. So we're going to have to get really creative in conversations with sheriffs and local and state police about where do we start as we're in the rebuilding. Meanwhile, I need to be looking very carefully at re-engineering my internal systems so that we can make sure we're getting quicker access to services, and so the right service at the right time and the right amount, so that we can start seeing our financial situation improve so we can do more as a community. So I'm going to conclude here and just say I really, really do want to hear from you. I thank Administrator Alger for working hard to connect me with other administrators. We're trying to get a meeting soon, and I'm trying to get in front of all of the rest of the commissions. I want to do my part and Northern Lakes' part, meeting your mission statement. Commissioner Hensel, I appreciated that this meeting starts with that, right? Responsive, effective, quality service. And I absolutely want to do my part, but I can't do it without you all. And there are hard conversations ahead, because we're going to have to make difficult priorities, at least in the short term, during this rebuilding time. So thank you very much. Chair Seifert, do you have more questions or comments? Or
I met with Ms. Zeller for lunch, and I was very impressed, and I congratulated Commissioner Morris on a job well done, tentatively, of course. But I know this has been a passionate project for her, and support her on all her efforts, and welcome aboard, and we're here to help. I mean, we're only going to serve our constituents if we work together. So,
thank you.
Anybody have any questions for Ms. Zeller? Commissioner Hanson?
Thank you so much for being here today. It's been 14 years since I was a board member on Northern Lakes, many CEOs ago. Most recently, I guess, what we've kind of seen out of Northern Lakes and a lot of the struggles were potentially retaliatory or nature, and mostly a lack of accountability. Can you talk just briefly about what your philosophy is about how are you going to bring that accountability to the, not just the middle level managers, but the boots on the ground, people doing the work? How do you bring that and ensure the accountability for the recipients?
It's a great question, and it really does need to start at the point closest to service, or you might call it the furthest out point. I'm doing a lot of little things that hopefully will become big things. It's all about listening and showing up and being there. I have 4 sites plus crisis sites plus homes. I'm getting out there. I make sure I'm at least 1 full day. So when I work in my office in Traverse City, I'm in Zooms or people coming to me all day. I can do that just as well in Grayling or in Cadillac. So showing up, being there, and trying to have my door open a lot. That's honestly where it starts. And listening, there's a lot of challenges that are quick and easy to address. There are a lot of challenges that have big systemic barriers. So that's where I start. Now, at the sort of governance level of accountability, there's also some significant things we've been misstepping on in terms of reports that need to come before administrators to help commissions. Our key performance indicators haven't been updated in a couple of years, right? We're still reporting on stuff from a couple of years ago. That needs to be updated. I want to have hard conversation with administrators and the counties and local governments in terms of, I can't do all 10 things that are really important to the community, but what are the first 2? So I would say it's sort of a really local grassroots with my staff effort, as well as a governance level. And a point of personal pride, unless you tell me, if you're trying to tell me something in confidence and it's done with the spirit of improving the organization, and as long as you're not telling me something that's illegal or something that I have to act on in that way, I am super true, integrity-wise, to confidentiality. I have a very short fuse for retaliation. So I'm very hopeful you won't find that being repeated. And thank you for your service to Northern Lakes.
Thank you, and thank you for grabbing the reins. You have our support.
Thank you. And you have a little card on your table rather than a PowerPoint. It has all the facts you'd ever want. So,
Commissioner Andrews.
Thank you. Last spring, the headlines were that CMH was facing a $7 to $9 million deficit. As we know, this board passed a motion unanimously to bring the director of CMH to tell us how that was going to get fixed. We put a timeline on that. We extended that timeline, and things happened, and it never happened. We never have gotten a report about how the deficit was fixed. You've made reference to some shifts last summer. This board has never gotten an understanding of what services CMH was providing and is no longer providing. The bottom line, right?
right. So we can, I can get you, it's fairly easy, and I'll get it to Commissioner Elger to distribute. Sorry, Administrator Elger, getting to know people. So in summary, there were about 17 positions that were eliminated, and there were very difficult decisions made around other types of cost containment. I can't speak exactly to which services. Most services continued, though not at the same level. Our clubhouses took really difficult hits in that they lost a couple peer workers. Those were eliminated. So I don't know. I don't know specifics to rattle off right now. I don't have that with you, but I can get from Kurt and company exactly what was adjusted. And and I don't have the facts and figures with me, so I know I'm not answering your question, but I am going to get the answer for you. And in order to go forward, I still am very, very flat, like what comes in and what I need to pay payroll and what I need to pay our providers is very, very even. There really is no margin there right now. So we have to have some difficult discussions. We're working in very close partnership with our Medicaid agency, Northern Michigan Regional Entity. They've been really good partners at working with us, trying to figure out how we prioritize a work to improve that. So, Commissioner Andrews, can you be real straight with me? Is there more information I can provide you right now, or would you like a report after this specific? What would be helpful?
So thank you for asking for clarification. I understand, at least my perspective, is that this board has historically been concerned about insufficient services at CMH, whether it's in the jail or the populations that are being served. When the organization took a 10% budget hit, services didn't increase, they decreased. So what I am seeking is an understanding of where we are now relative to where we used to be in terms of the types of services that CMH is and isn't providing. I don't believe that's probably something you can provide standing there at the moment, which is why we specifically requested, with notice, a presentation, and as I meant, changing in personnel and all of the interim situations and all of that made that information that we were unable to receive. Now that you're there, once you are able to, I would like, and I don't know what the rest of the board's perspective is, but I would like an understanding of the things CMH, the services CMH was providing in the community, and as a result, if there are services no longer being provided or populations no longer being served or being served in a different or lesser way, where those things are. I think that's what we've been asking for since I believe it was in April that we asked for that information.
That's a very fair question.
Thank you.
Thank you.
Just to follow up, I think if we can get you on an agenda so the public knows you're going to be here with that report, it would be great for the public benefit to have you come back with that information, get it in the packet, within the next, by the end of February. Well, it sounds like, does that seem fair, or do you need more time?
I can certainly provide you information in February, and I think there are some important points that earlier, if I could share, about where we were, what we had, what was lost, why it was lost, what we're trying to do to go forward. So I do think I can provide you some early information in February. I won't have gotten through all the other counties yet, but I think I can provide some specifics for you all. Some basics. It's probably the beginning of a conversation.
Yeah, I think related to that was like the audit issues and where we are with that. And so does that, by the end of this quarter, sound more realistic?
I can certainly provide you better information at that point. We are closing out our fiscal year 2025, which ended in September. Those financial status reports won't be available till early March, so that probably would be more helpful. The other reports that are due then, there's one called an EQI report, which is basically what services did we provide to whom, funded by Medicaid, what services did we provide to whom, funded by general fund. So I think at that point, I can probably provide you better information.
Yeah, so mid-March.
And historically, we also did get a report on those KPIs, even though, and we acknowledged in getting them that they were not as targeted or tailored as they needed to be. But getting that snapshot review would also be helpful, acknowledging that those KPIs need updates.
Yes, I can easily provide that. I provide that quarterly within the board packet. I can easily ensure those get to the county proper too as well.
Thank you. Any more questions for Ms. Zeller?
Thank you.
Thank you for
Thank
the
you.
opportunity.
Thank you for being here today. All righty, we're going to go to B1, items removed from the consent calendar. Commissioner Walter?
Thanks. I just have an adjustment to the minutes at the organizational meeting. It said that former Commissioner Brad Jewett was present.
I did really.
That was already corrected on the iCompass. If you look at the
Well,
iCompass. Yeah, we
it's right
caught
here.
that, I know. We
I
caught
caught
that.
that.
Fern caught it,
I
and,
brought it to their attention.
Well, it's still in there,
Thank you.
so.
yeah.
Oh,
It's been corrected out on the iCompass minutes.
I felt it was important.
Apparently Lisa pulled from an old template or something, and
Yeah.
I didn't
I don't
catch
show
it
him on mine.
when I was
Well,
proofing it.
it's still, I mean, I clicked on it, it's still there, so.
It's still on the packet, that's on the website.
It's in the packet, but not on the, if you go on the website.
I'm on the website, I went.
Well, whatever it is, it
Yeah,
needs
it
to
was
get
supposed to,
adjusted,
Lisa said she
so-
fixed it, so,
Well, I-
Fixed on the one I'm looking at, so there you go.
yeah.
Confusing.
Yeah, if you go to
Clear as mud.
January 7th and then click on it, it's corrected on that, not in the packet.
It
but
probably depends on when you downloaded the packet, but it needs to be
Well, I just pulled it
fixed.
up again this morning, so,
It's not fixed in the packet, it's fixed in the system.
okay.
I always use the link. I don't ever use the packet.
Mr. Chairman, this brings up a procedural issue
Yeah.
that has been recurring. When we get the packet on Friday,
Yep.
we download it to our local hard drive, and then we read it over the weekend, and we come to this meeting prepared. If there is a change online, we might not know about it. So we need to be notified if there are changes happening to the packet, throughout Monday, Tuesday, workdays.
I agree.
I agree.
I would make a motion. Whoever's,
Get it.
we don't make a motion, it didn't happen, so I'm going to make the motion. If there are changes to the packet on the interwebs, or on the packet, or anywhere else they happen to go, the board requests an email.
Second.
We have a motion by Commissioner Andrews with a second by Commissioner Henschel that if there are changes made in the packet, that the board members receive an email highlighting those changes. Any discussion? All those in favor say aye.
Aye.
All those opposed say nay. Thank you, everyone.
Mr. Chairman, move to approve the minutes as amended.
Second.
Fantastic. Commissioner Henschel, with support of Commissioner McAllister, move to accept the minutes as amended. All those in favor say aye.
Aye.
All those opposed say nay. Thank you, everyone. Now we're going to move on to 8A, Proposed Justice Facility Advisory Committee and Justice Technical Committee makeup. Mr. Alger.
Good morning, Commissioners. The Executive Steering Committee met specific to the membership designation for the Justice Facility Advisory Committee and the Justice Facility Technical Advisory Committee, also known as JFAC and JTAC. They came to a consensus with a list of positions and some names that were specifically intended to be part of both committees. And there are a couple additions as we have gone through and past that meeting that I'd like to highlight. The agenda item that I have provided to you includes the overwhelming lion's share of positions and names that the Executive Steering Committee included in their recommendation to the Board of Commissioners. There is a couple of changes to this that I'd like to highlight. Under the JFAC, which is the first committee that the committee has recommended, Paul Lipinski has agreed to serve on that. Darcy Pickren and Craig Wilson submitted applications to be part of the JFAC. When we reached out to Keys to Freedom, the president of Keys to Freedom, Tina McNally, Chaplain Tina McNally, asked to be part of that JFAC instead of either Darcy or Craig. Apparently that neither Darcy or Craig are on the board at this point in time for Keys to Freedom. So I would make that amendment or recommendation with the chair and vice chair's approval. Also, Commissioner Andrews mentioned this morning, we did have a conversation about BDAI being part of the JFAC before, during, and after incarceration. That organization should be represented within the JFAC. They did not submit any type of a formal request to participate on that, so it was off of our radar. I would recommend that we include membership from BDAI on the JFAC. And what am I missing? Anything else? I don't think there's anything else specific.
I don't think so.
One member who has been a vocal advocate and wants to be part of the JFAC is Darcy Pickren. She did not necessarily submit something to us through our application process, but in the event that this board feels that she should be represented or she should represent the JFAC, I think that would be appropriate as well. Anything else? Chair, Vice Chair?
Thank you, Commissioner Alger. I will just want to point out that we acknowledge that this is a big committee, but that is intentional because there's a lot of voices and perspective to be brought to bear on the input into what the systems related to the Justice Facility are going to look like. I think we are looking for commissioners. I have informally heard some commissioners who are interested to sit on this committee, but I do think we want to name up to 4 commissioners here today. And then I think, for clarity, I think the request is that we would open a seat for BDAI, allow Keys to Freedom to I didn't catch the name of their chaplain, and then invite Ms. Pickren, who has a lot of experience in the jail and with discharge and people coming in and out of the jail, to participate on that committee as well. But I think the only piece that we need to discuss is anyone missing? Which commissioners want to be on here? And is there any concern about Ms. Pickren, BDAI, being added?
I would like to make another note. Crystal Frost Anderson was also discussed at the meeting. I did speak with her. She is absolutely interested in being part of the JFAC. That was not something that was necessarily enumerated here. She is currently working with Networks Northwest in terms of reentry programs for MDOC and Michigan Department of Corrections. My apologies. So I think that's an absolutely appropriate add-on as well. So Crystal, with the addition of BDAI, Crystal Frost, Ms. Pickren, and the change to Keys to Freedom, I think that wraps that committee up.
And can you repeat the name of the Keys to Freedom representative?
That's Chaplain Tina McCallie.
Okay. And maybe this happens frequently and it's not an issue, but Darcy Pickren has been affiliated with before, during, and after incarceration in years past. And I'm curious why she's coming in as a individual rather than with an organization. And maybe that's not a problem to have individuals who are interested. I always welcome people. More people to the table makes a stronger organization, but just curious.
Ms. Pickren is a unique individual that she has a history of working with incarcerated folks for decades. She has a work resume that's probably second to no one on this list. So she has worked for many different organizations over time. So she's going to have a perspective of what organization works this way, which organization works that way. She has a pretty good voice in the community, as do several of these other people on the list. We're like, well, why is that person on this list? So this is to remind you that the JFAC is the outreach portion where we're going to be having people and we're going to be holding open meetings and forums and things like that. But also let you know, for the commissioners that are interested, this is going to be a hot and heavy, we're going to get this done, and it's not going to take 8 months. The meeting schedule is going to be more like 8 weeks. So it's going to be a lot of meetings in a short amount of time.
Do we have a time on the
So-
meetings and what?
Not
Sorry,
yet.
no,
I'm
not yet.
sorry.
Just to follow up, Commissioner Spence, I think Ms. Pickren could come in under her BDAI hat or under Keys to Freedom hat, but those organizations deserve a seat independently, and since she's not currently on the board of Keys to Freedom, and I don't believe BDAI has told us who they want their representative to be, we want Ms. Pickren's voice heard either way. So that's why there's sort of a special carve-out for her as an individual. And just to be clear, these are going to be open meetings. Everybody who wants to go to these meetings can be at these meetings, whether they are an official member of the JFAC or whether they are just in the audience and speaking. But her voice was noted, and she's raised her hand multiple times to say she wants to be part of the committee.
Thank you.
No, to Commissioner McAllister, Administrator McAllister,
Killing me.
joking. The dates and times. So remember, we hired GFC to facilitate these. We have that. We just approved it in consent, the contract with GFC. They're doing some preliminary discussions as we speak to sort of get their thoughts together. They're planning, they're in DC, and they're going to come for some of these meetings, but it's going to be in-person meetings, probably not till March, by the time she goes through some preliminary planning and organizing and convening, and then they'll probably be fast and furious after that. But no, we don't, and I think it's going to be daytime meetings and evening meetings, and there's going to be combinations. And if you want to be on this committee and you can't make every meeting, it's fine. We can't expect 30 people to make every single meeting of the JFAC. It's just unrealistic.
Well said.
So we would need to identify 4 commissioners. The chair and the vice chair are part of the executive steering committee. They have stated that they would be ex officio members of the JFAC in the event that 4 commissioners were not willing to sit. If they were willing to sit, if not, they would be voting members.
Well, I would like to. There's room.
We want 4, right? Of the,
We want 4.
I'd be willing to step into that role. Thank you.
Okay. Well, we're looking for the fantastic number 4.
Did you hear, Penny?
I did. I've only heard Brian, Administrator McAllister, Commissioner Spence, Commissioner Morris. So I'm looking at you, Commissioner Walter.
Oh, I'm just confused, like, I know that you're saying you can't vote, but isn't it still a potential quorum issue, even if you're not voting and you're talking about things that will come
It's,
through?
it's being run as an open meeting. There's no quorum issues.
I'm just excited about the pay raise.
Gonna double your per diems.
To be honest, I'm not sure what voting would take place. Maybe it's sort of a prioritization but I don't, even if a quorum of the commission were on this as voting members, and then this committee as a whole, let's say it's 30 people, and let's say they voted to prioritize, medical care, mental health care, and discharge provisions as the top 3, and they took a vote on that. I'm not saying that this is a hypothetical. So I think the fact that 5 out of 30 people were commissioners of this board wouldn't be any sort of quorum violation, because the vote is of the committee, right? That's a vote of that committee. If 16 out of 30 people on that committee agree with it, and no commissioners or all the commissioners were part of the majority, it doesn't bind this board to anything. It's that committee's vote, and they're open meetings, so I don't know that it being a quorum is a challenge. And it also doesn't matter. Let's say they did that. Let's say the hypothetical where they said, these are our top 3, and then it comes to this board, and this board decides to do something completely different and make, opioid responses the number 1 priority. The fact that 5 people voted over there doesn't bind this board in any way. So I'm not sure that the fact that there are 6 commissioners attending those meetings raises a problem.
Overwhelmingly, the JFAC itself is largely advisory, and it's intended to bring in GFC and Galik Cohen, the facilitator. She will collect input. She'll collect information. She'll organize it for review, and we have a nice organizational chart in creation mode at this moment that shows how the information flow will go from the Board of Commissioners through the Executive Steering Committee down to the 2 committees through Galik Cohen, and then how she will be communicating back to the Board of Commissioners through the 2 committees, or the 3 committees, and getting that back to you. So I don't know if there's going to be a lot of voting going on. I think that the nature of those decisions would be, we want to see more of this, or we want to see more of this, or we want to hear from this group or that group. So that's in play right now. So it is an open meeting. I don't think there is any concern about the nature of having 6 commissioners present.
Any more comments, questions, or concerns? Or additions? We did. We had 3 commissioners. Three's good, and you
I
and I can
nominate
alternate.
Daryl.
So I mean,
There are rules.
as to Commissioner McAllister's point, once this is firmed up in terms of the schedule, if a 4th wants to be assigned to it, if somebody who is assigned to it wants to get off of it, we can address those.
Yeah, it's kind of schedule oriented, because if it really starts in April, then I'm hesitant to commit just because I'm gone a lot in April and early May. So that's the only thing, if that's what we're looking at, is a lot in April and May, then I'd like to commit to actually being there and not just being on the committee and not coming. So
Appreciate
we'll
that.
have to
Thank
wait
you.
and see what the schedule is.
That's legit.
So then, unless there's, I'll make a motion. Would that be helpful?
It would
Sorry.
be.
So we wanted to remove Mr. Wilson. We want to add BDAI representation.
Yep.
Crystal Frost.
Yep.
Darcy Pickren.
Yep.
And identify Chaplain Tina McCallie as the Keys to Freedom representative. Thank you.
We're going to, so,
In addition to the 3 commissioners that volunteer.
Correct.
okay. So I'm going to make the motion that the board approve the JFAC membership as presented with the appointment of Commissioners McAllister, Spence, and Morris, with the replacement of Chaplain Tina McCallie in place of Craig or Darcy Pickren on behalf of Keys to Freedom, with the addition of BDAI to provide a representative, and with the addition of Darcy Pickren and Crystal Frost Anderson.
Second, and I have a question.
All right, we have a motion by Commissioner Andrews, a second by Commissioner Walter. You got that, Clerk Shealy? Question, Commissioner Walter?
Well, Crystal Frost wears a couple hats related to this, and I don't know if it matters, but should we clarify that it's not a community mental health board representation and that it's part of her work, or does it matter? Part of her work?
I think the same rules, or in my opinion, the same rules that apply to Darcy Pickren's appointment are going to apply to Crystal Frost Anderson. I don't care what her job is. She's well-versed in that community, held a lot of jobs, wore a lot of hats. She's going to have insight that some other people don't have.
So to clarify, we could say that the addition of Darcy Pickren and Crystal Frost Anderson in their personal capacity, so that they are not there in any formal on behalf of an organization, but it doesn't exclude them based on their whole life experience. Is that more clear?
I don't think it was delineated out who were they
This
representing.
could be iterative, right? We can adjust going forward. So friendly amendment, those two in their personal capacity.
Got it.
Fantastic. All right, is there any more comments, questions, or concerns? All those in favor say aye.
Aye.
All those opposed say nay. Thank you, everyone.
In addition,
Chairman Seifert, just for the public, maybe there's so many acronyms being used, and I don't know if they know what JFAC stands for, or some of these
Fair
other
enough.
things. It might be helpful for the public to explain what these acronyms stand for.
Sounds good. Good idea.
so the JFAC is the Justice Facility Advisory Committee. This is the committee that the board just approved membership for. The JTAC is the Justice Facility Technical Advisory Committee that you will appoint here momentarily, I hope. And MDOC, Michigan Department of Corrections. Which other ones did I use?
ED.
Before, during, and after incarceration.
So we can go through them too. So we got, first one's going to be TCPA, which is going to be the Traverse City Police Department, MSP, which is Michigan State Police, NLCMHA, Northern Lights Community Mental Health, ATS, which I'm not even sure what that stands for.
Addiction Treatment
Addiction.
Services.
There you go, thank you. And then we got NAMI, which is what?
North American Mental
Alliance for
Health.
Mental Illness?
Yes, there's mental illness in there. And so I in a very layman's terms, course, Cliff here, I don't want him to throw something at me when I say this. I look at this as that the folks at home, that the JFAC is the software and the JTAC is the hardware of our build that we're looking at. So my apologies to those people that know better than me on that. So under the JTAC, there's the MMRMA, which I have no idea what that stands for, but that's our insurance provider.
Michigan Municipal Risk Management Authority.
Thank you. Then we go to the next one down, is again TCPD, which is Traverse City Police Department, MSP, Michigan State Police, Grand Traverse County Facilities, Grand Traverse County Health Department, Traverse City Fire Department, and MIDC is Michigan Indigent Defense, what's the C stand for?
Commission, I think.
Council?
Commission.
Commission, thank you, which is essentially a public defender, for those of you wondering what that is. Any questions about any of that? All right, so on to the JTAC. Are you satisfied with that?
Yes, I think that helped, didn't you?
They look just as confused as before, my apologies. Commissioner Alger, please continue.
Representing District 10. So in the packet, my apologies, the executive committee is recommending that we appoint those individuals and positions to the JTAC, the Justice Facility Technical Advisory Committee, largely technical in nature. So on this, you'll see MMRMA, which is Michigan Municipal Risk Management Authority, Tom Cremante. Tom Cremante is the resident jail expert for our liability provider. Going to be a very nice asset for the committee. He looks and works with jails, counties, municipalities all over the state in the operation and current construction of jails. The Michigan Department of Corrections, Larry Abraham, is an inspector for MDOC. He does our inspections for our jail. He is going to be on the JTAC and will largely be responsible for making sure that the recommendations that we're talking about will stand up front with our code for construction of jails. Steve Scott is our local Michigan Department of Corrections parole agent that we think should definitely be part of that conversation. And the rest, I think, are self-explanatory with maybe the exception of, I think they're all fairly, Bob Hall, I'm sorry. Bob Hall was our jail administrator. He served in our for the Sheriff's Department for 35 plus years. He went through a remodel with our current jail, and he will be responsible largely for bringing that technical committee up from where we once were to how we got to where we are now with our correctional facility. And he's got a lot of experience and information that will be helpful for the process.
Thank you. Any comments, questions, or concerns on that?
I have a question about, it looked like the memo recommends an emergency medical services representative. And I don't think that Greg Bird is a really like an emergency medical services person.
not.
So do we have somebody in that
So
capacity?
it turns out that Chris Como has that experience. He's our facilities director. He also has experiences. He's a first responder. Or
He's
was.
a fire chief.
Fire chief, thank you. And also we have Chief Tuller, which
Well,
should
she's not going to
Won't be
be
Chief
on
Teller.
there, but somebody from.
Yeah.
It'll be most likely, I think it's Lieutenant Fritz. He does the inspections locally. I believe he will be the designee.
the idea being the fire department. So if there were an emergency that brought in a first responder, presume the concept is that between those, they would get that perspective heard.
And from the JFAC perspective, Tori Sykes, who is up the chain in the emergency department, she's in charge of, I think, all that goes on there, and she will bring valuable information about the interplay between the jail and what occurs between the jail and the emergency department. We visit their ED pretty frequently, actually, and that information will be helpful to have.
I don't see her in
She's
this.
on the previous list, the JFAC list.
Well, should we have her on this, though? I mean, since it's about the,
I suspect that on a day-to-day basis, or the JTAC probably doesn't need to know exactly how the emergency room functions in order to design, to look at technical aspects of design, like turnaround areas and enough area for a stretcher to get in the door, or those sorts of things, right? Like, once they get to the ER, there are challenges, and that's the soft part, but the hard, to use the analogy that Commissioner Seifert used, the hardware side of the building, I mean, if that perspective is useful, obviously they're going to invite that perspective to the meeting. Out of respect for their time, whoever that person is presumably has a lot going on over at the emergency room, that having them be on both committees is probably a big ask. So I think that was our general perspective.
That makes sense.
Anything else? Anyone?
Should I make the motion?
Would you please?
I will make the motion that we approve the Justice Facility Technical Advisory Committee membership as presented.
Second.
We have a motion by Andrews, a second by Commissioner McAllister to approve as presented. Any more comments, questions, or concerns from the board? All right, seeing none. All those in favor say aye. Aye. All those, what's that? Yeah, Commissioner 10, District 10 says yes. All those opposed say nay. Fantastic, thank you, everyone. Thank you, Mr. Alger, Ms. Shealy. Moving on to 8B, Mr. Alger.
So we were asked, we all saw in the paper that United We Smile had closed. The county, through the Veterans Affairs Office, has a relationship with United We Smile. I was asked to have Mr. Roof here today to kind of update the Board of Commissioners as to how that movement, that change affects his office and the veterans associated. So, Mr. Roof.
Yeah, thank you. Michael Roof, Director of Grand Traverse County Veterans Affairs. If you've been on the board long enough, you know that the last couple years you have approved, along with my committee, to donate, contract with United Way, United We Smiles Dental Clinic, that they pay absolutely free for veterans, pay free to get their dental care done. The first year it was $6,000 a month. The second year it was $12,000 a month. And actually every year I came, various members of the commission said, is that enough? Should we give more? What can we do? You know, we want to make sure veterans are taken care of. So first and foremost, thank you for always doing that and looking out for veterans. Your support makes it easy to do my job. There has been things recently in the paper that you read about. The clinic was closed for various reasons, but because I wasn't on the inside, I only got some of the information. I'd like to bring up the person who used to be the manager of the United We Smiles clinic, Jennifer Kearns, to talk a little bit more about it, because I think it's best that it comes from her than me, but know that I was contacted by United Way in mid-December and asked if we would continue our $12,000 a month. I said that we had no contract because the contract that you approved ended December 31st, so currently we're not paying them anything because we don't have a contract. And then 2 weeks later, they started telling me they were closing down. So that's really all I know on that side. So please have Jennifer come up and speak a little more about it, if you're okay with that. Jennifer?
Hi, my name is Jennifer Kearns, and I am the founder of United We Smile. And with me, Dr. David Carlisle came. He was our dentist. So we are happy to answer questions and try and help out as best as possible. This is a true tragedy for our community, and it did not need to happen.
Mr. Anchel.
Thank you for being here. Dental care is a large quality of life and holistic full body health issue for veterans and all our community members. We were very excited about this program for all the years that it ran. And I was wondering if you can go into maybe a little behind the scenes, what happened, where, is it a funding issue, is it a management issue, what happened to this program?
So, so I'm a dental hygienist, and I used to drive around in a dental van for over 10 years. And I realized the access to care issues and where we needed to fix those. So I approached some different organizations and decided to partner with United Way for this clinic idea. And I started United We Smile after writing grants for 4 months to raise enough money to build the clinic and renovate a space and have all the equipment. So we did that, and over the last 2 years and 3 months that we've been open, we provided for veterans $1,246,298 of free dental care. For total patients in 2 years and 3 months, we provided free dental care valued at $3,766,183. So that's free dental care into our community, serving only the people that are turned away by other dentists. So that includes pregnant women. Those need to be a priority. Of course, veterans who are turned away, don't have access to a lot of insurance. Also, people with what we call specialized healthcare needs, disabilities, intellectual, developmental, neurodevelopmental disabilities that not a lot of dentists are trained to work on, and pre-cooperative children with behavior issues that cannot find a dentist who will work on them without sedation. And sedation dentistry costs quite a bit of money. So we've saved the emergency room department tons of money by taking on emergencies, working with street medicine, working with all of the folks that kind of fall through the cracks that the public health centers cannot treat. So we were serving that gap, and we were doing it with dental students as our overhead labor force. So having very minimal labor, using dental students overseen by Dr. Carlisle. So we had upwards of 16 dental students a day sometimes, and they would do the work overseen by Dr. And we had up to 22 volunteer dentists in the community that would also come and volunteer on different days. And we'd oversee their work, and we'd teach the students how to work with these populations that have health conditions, these challenging comorbidities that are not easily treated in the regular dental office. So we were improving access to care by graduating over 300 dental students in these past 2 years to be able to do this work and be able to see pre-cooperative children and all these other things so that they weren't turned away and bouncing around without dental care. So our budget has not changed. We are coming in under budget every single month. And when I partnered with United Way, it is because I needed a fiduciary. As a dental hygienist starting a dental clinic, I needed to partner with someone who could manage my books for me so I could focus on patient care with doctor. Over the years, money became an issue, and we started realizing issues. Our executive director of United Way resigned in May. He was gone. He left for those reasons. He saw what was happening, and we started investigating more, trying to take time away from patient care to investigate what was happening with the books. Then some other things happened, which I don't know if I'm supposed to be divulging. And I think it's pretty public that in October, United Way lost their early childhood programming. They had to let all of those employees go, and it went to a different organization downstate who then hired all those people back, and the programs returned to normal. So when your fiduciary is struggling financially, we don't think it's appropriate to dip into our bank account. And it is not the clinic's responsibility to financially support United Way.
Have you looked for a new sponsor or fiduciary?
So there was money taken out of my account to pay for legal services that merged United We Smile and disbanded my board in June. I was not aware of that. I have no control of United We Smile. There is $2.9 million at the state that was allocated to me to purchase the building. So when I started the clinic, the one thing that was really a financial challenge for me was the mortgage in Copper Ridge. So we had a 2-year plan to figure out how to buy the building, and then our finances would be self-sustaining. So in the two first years being open, it was our goal to try and purchase the building. So we were doing fundraising. So when I passed appropriations to get the $2.9 million to buy my building, that was the last remaining financial piece that we needed. That money was listed to go to United Way. It now says United We Smile, more accurately, thank goodness. And we don't really know what's happening to that, because if United Way owns United We Smile, whoever owns United We Smile gets the $2.9 million as long as United We Smile stays functioning with the same populations and the same treatment that it's been providing for our community. So the fact that they let all of us go, and we lost our jobs and closed the clinic, we don't know what's happening with the $2.9 million. So we are kind of concerned as well, and we would like the clinic to go back to normal. Do you want to add anything?
December 5th.
Sir, tell us who you are,
Oh, I'm
please.
sorry. My name's David Carlisle. I'm a general dentist, and I was hired by Jen in United We Smile to be a staff dentist. Prior to me joining, it was the 21 volunteer dentists that were overseeing the students. We call it a preceptor. So dental preceptors from the community came in, oversaw the students, and what was happening, especially with the veterans, is a lot of them have very complicated treatment plans where we're removing teeth, replacing.
Use the mic as much as you can, please.
Pardon me.
Yep.
So what I felt, what I was able to provide was this consistency of care. Okay, so every Friday we saw the vets. The vets would show up. Volunteer dentist A is there that Friday. Maybe the next Friday, volunteer dentist B is there. And so with some of these complicated treatment plans, there wasn't much continuity of care. So I was hired to be that. I would 5 days a week working with the students, got to know the patients, knew their treatment plans. So I felt like once I came on board, we were really in tune. Like Jennifer mentioned, we had a small team. We had a community healthcare worker. She provided, when we had patients that needed services beyond dental, they could go talk to Carrie. Hey, I need help with transportation. I need help with housing. I need help with food. So we had a community healthcare worker. We have a receptionist. We have one dental assistant that helps with the sterilization processing of instruments, organizing, ordering supplies, staff dentist, and our director. As Jen mentioned, once the executive director stepped down in May and then the board took over, again, then we had Board of United Way, Board of Directors, United We Smile Board of Directors. Again, as she mentioned, without us knowing, they dissolved the dental clinic board, absorbed the office, expressed to us their concerns about financial responsibility, fiduciary responsibility that the board has, and think the books weren't looking good. You know, what can we do to increase revenues? And in my head, you know, this is stuff you talk about when you're talking about private practice. We're not increasing revenues, we're increasing access to care. So I'm repeating a lot of what Jennifer said, but my perspective, May, CEO leaves, June, board takes over. I think it was September, and they let Carrie go. They eliminated her position, our community health care worker, which was one of the key roles in our office that made it so unique.
Yep, and she lost her job because they needed to make payroll on their side of the building.
Just maybe 3 weeks before that, they told us, they meaning the board of United Way, told us, meaning this clinic staff only will be getting a 10% pay cut. So this is a solution to becoming more financially stable, was to eliminate positions, give us pay cuts. And again, we're still all concerned. Every time we turn around, and we don't know what's happening. There's no transparency. After our CEO left, they guaranteed transparency. None. There was none. We had no idea what was going on. We felt, are we on a sinking ship? Do we need to bail out? Are they going to close the clinic? Should we bail out before they close the clinic? So on and so forth. So we operated like that until December 5th. We had a regular work day. At the end of the day, we wrapped up. Jen had a meeting at the end of the day with the acting director. And then about 5 p.m., I got an email from her saying, we've eliminated Jennifer Kern's position. And I thought, wow, how are we going to operate? I mean, I'm a dentist, and I can do the patient care. But Jennifer has the skills to see these patients, maybe not so much the veterans, but we see a lot of kids with disabilities. And whether those are physical or more often intellectual or cognitive, I don't think I could treat that patient population without Jen being in the office. And I expressed the concerns to the board. Once they met with us after they got rid of Jen, they hired a consultant. Again, they throw money different places. They hired a consultant, not for the clinic, but for their overall financial stability. So I'm going to them like, my concerns, how am I going to oversee 14 students, just me, come Monday, January 12th, when we're back in business? How am I going to treat these patients without Jennifer in the office that has training to do certain techniques? We do non-pharmaceutical dentistry, so we're not knocking kids out. We're giving the kids the skills they need to become good dental patients. Oftentimes, we would utilize a procedure where we use a restraint. It's called a papoose. It's for the safety of the patient. It's for the safety of the provider. I'm not certified. I didn't go through the training. We had Jen in the office. So when I expressed the concerns of the board, like, how am I supposed to pick this up and keep it going without Jennifer here? I don't have this training. U of M, we have a contract with U of M to provide a certain number of preceptors to a certain number of student ratio. That would be gone because Jen is a preceptor. So we always had 2 preceptors. And it just kind of fell on deaf ears. I wasn't even talking to the acting director. I was talking to this consultant they hired, Joe Garcia. And his mission is really to find money, not to find me help, not to keep the clinic going, but it was just simply to find money. So once I expressed my concerns and nothing was really happening, as far as, well, who's going to replace Jen? Are you going to give me the training I need to keep this going on? I would get no response. So they just figured come January 12th, I guess Dr. Carlisle will take care of it. I expressed the liability concerns. You know, we have had emergencies in the office during treatment. We had a young patient, a 4-year-old nonverbal autistic girl, aspirate a small dental instrument when getting care by a student. And I thought, if something like that were to happen, and I'm one preceptor, and we've got 15 patients in the clinic, and I told him, and this is kind of traumatic, but it can happen. What if a kid dies? I'm liable. I'm liable if a kid dies in that chair. And they didn't seem to have any concern about that. So I made the decision to give my resignation. I gave my resignation on December 30th. I said, I will work through January 9th, and I thought I could help them with the transition, which would mean contacting patients. We have treatment in process. A lot of these vets have dentures sitting in boxes in the office, waiting to be delivered. Or there's stages when you make teeth. You do a try-in, you bring the patient back to check it before it goes to the deliver. So there's stages. So we've got multiple, at least 21 cases in process when there's no dental clinic. There's no dentist now.
And he offered to stay and deliver all those teeth, and they literally turned off his account and ghosted him.
So when I sent him my letter of resignation on December 30th, the response was, well, that's great. Let's just make today your last day. That was their response. And, you know, I think it's like, oh, well, great, then they don't have to pay me benefits. They don't have to pay my salary anymore. So it's just, so I don't know what happened. I don't have the facts because there was no transparency. But I am just so afraid that they were double dipping. Money that was coming from the VA, $12,000 a month that was to go to our care. I'm sure with this financial distress they're in, that was going somewhere else. They talked about some of the grants they had where they do the work and then they get the grant money. So they had like this negative carryover, and I think they lost track of it. I don't know for sure. I don't know the facts. I can only speculate. But it went down really dirty. And it was such a great place. I mean, as you can get, we both get so emotional about this. I think I've got my point across, so I'll just keep rambling.
Can I ask, other than your infrastructure, just considering like staffing and supplies, what was the annual budget roughly?
So we were spending $888,000 a year. And so so numbers can't lie. I mean, I've run dental practices before, QuickBooks, it's balancing a checkbook, it's not that hard. When you take a small organization like United Way and it grows exponentially in 2 years, I think things can start to happen with the books. Our books are just one little dental office with a budget you don't change. So for example, $6,000 a month for dental supplies, we spend $5,000. It's not rocket science. We ended up canceling our cleaning company to save $2,000 a month cleaning the dental clinic each week. And so I started cleaning toilets. Laura started cleaning the floors. We all chipped in. Like Doctor said, we took pay cuts. No one else got pay cuts in the organization except for us. Our books were the only thing that were legitimate and self-sustaining. So with that, $888,000 expenses, with the income coming in, if we bought the building, we were only $3,000 to $5,000 short each month, but that does not account for all the donations that were coming in. That doesn't include the $50 fee for uninsured patients. It doesn't include the $300 donation that parents stick in the box when they come in, because everything is free because we're training students. So a tremendous amount of cash donations would come in. There's no reason. We are a self-sustaining clinic, and there's nothing wrong with our books.
Do you have a follow-up? Commissioner Spence, I saw you had a hand up.
Yeah, thank you. Gosh, this is a lot to absorb, and I'm sorry about what's going on. You said that you had 12 students who are working there right now, the interns from the
University of Michigan found out recently that they closed the clinic. So those students now have to find other places to go. So when I started the clinic, we became a CODA accreditation satellite for University of Michigan, which means that in order for University of Michigan to keep their dental school accreditation, the students that graduate dental school have to meet certain requirements, and some of those requirements are really challenging to meet. So our clinic actually checked that box for them. So University of Detroit, University of Michigan wanted to send their students to us to learn how to work with non-pharmaceutical management of behavior, all these challenging comorbidities that is a requirement to become a dentist. So being that site, taking those students on, those students now have to figure out how to graduate dental school, and the dental school now has to figure out how to check that box so they can keep their accreditation.
And they're paying tuition as well.
Yep.
I've been there, so I feel really, this is really, I don't know which way to go with this, except for who's your board? Are they local people?
United We Smile no longer has a board because United Way merged with and disbanded our board. So it's the United Way board that is in charge. And yes, they are local.
I did my research. I looked at many articles from when it opened in 2023, and the $2.9 million that was appropriated for the purchase of the building. When you first got up to the podium and spoke, you said that you weren't sure where that money was.
I know it hasn't been allocated yet. So it is city. I mean, we would love to be able to talk to Representative Roth and find out what's going to happen to the 2.9, but the building purchase is 2.47. So that allows, obviously, plenty of money left over, which I don't know what that money was going to be for. So I only needed 2.47 from the state to buy my building so I could be out from under that lease each month. And the people who currently own the building are great to work with. So it was all going very seamlessly. And the other side of the building, so mind you, this is a 15,000 square foot building in Copper Ridge. I only take up around 7,000 square feet of it. So I also found out I was paying the majority of the mortgage. That was not the agreement. We were supposed to split it down the middle because I only take 7,000 square feet. So, you know, there's a lot of things that were happening that weren't straightforward. And if I could just buy the building, then it was fine. And that's what the 2.9 was for. But without the clinic, you can't get the 2.9. So I would assume you would either have to file for bankruptcy or you would have to get some other organization in to start the clinic up. But like Doctor was saying, I'm the only one certified to teach that. And I don't know what you're going to do. You just let go the entire small team that ran the entire thing. So, I mean, the ripple effect is huge. I mean, we have patients from downstate that cannot get help. Henry Ford Hospital's trying to develop a program to help everyone downstate because they were coming up here. I mean, we served the people that could not get help, and the dental students were learning how to do that. Now you've got, you know, Father Fred, Salvation Army, St. Vincent's are all going to feel the impact because now they're going to have to start forking out money to help patients get care. The public health centers, they don't have the capacity or the training to be seeing this population. So this entire population is now going to fall through the cracks. But like I was saying, if I'm only doing 7,000 square feet of a 15,000 square foot building, the goal was to rent the other half of the building, not have 3 employees sit there in 7,000 square feet, and I'm paying the mortgage. So, you know, having the VA come in that other side of the building, we could turn the entire Copper Ridge thing into a vet center, and we could expand programming. They're already paying $12,000 a month to the clinic. If you add a little bit of rent in there, I mean, we're only $3,000 to $5,000 short per month. And that's, I don't have the calculations on the cash donations and all of that, but I'm sure we surpassed that.
I want to wrap this up a little bit because I can appreciate this, and this is going to be a rabbit hole and a deeper dive, but I want to thank you for being here. My final question, I'm going to ask real quick. Mr. Roof, what's the plan? I appreciate them. I mean, do they owe us money? Who's taking care of our vets' teeth?
So do they owe us money? No, per the contract, it was a payment,
Okay.
right? What we did previous to using and donating to them, we utilized the Michigan Veterans Affairs Agency. It was called a County Veteran Service Fund grant. And various amounts every year of what we were approved for, we would send people over to next door to the health department, to Dental Clinics North, and we would have them do an assessment for $50 and then tell us what the needs were, and they would give us a good rate to pay directly to fix someone's teeth. We don't have anything in place yet because we don't have any, you know, this just happened. So we've heard from 2 or 3 veterans that have not been fixed wholly. But from what I understand, those people are now going to be taken care of, I think, right? You know, that's what they're saying now. So the ones that were in process might be made whole. But for the future, we don't have anything in place yet.
Mr. Andrews, you have more
Yeah,
to add?
hold on.
Yeah, so it seems to me that we have 2 problems. One is how do our members, our vulnerable community members, including veterans, pediatrics, and others, get the services they need? And my question for Mr. Leahy is, does Dental Clinics North provide those services to our community members such that while it may not be enough, there is a access to dental care for indigent and special needs patients? Is that correct? At least going forward, we have a stopgap, right?
We accepted referrals from Dental Clinics North and the public health centers. So we are a very specific type of treatment that they weren't able to do. And so we weren't taking patients from any offices, any public health centers. We weren't crossing over treatment. We're doing the treatment that cannot be done at these other places. So we did take all their referrals. So those people that you're speaking of just will not receive care. Just flat out will not receive care. But I can tell you that one of our volunteer dentists, Phil Yancho, Dr. Yancho, and his son, Joe Yancho, Joe just recently finished the Navy and is a dentist also, and so he joined his father. And they have both volunteered for years in the program, and Joe was actually one of the students in the program when he was going through dental school. So they have graciously agreed to finish the 20-some veterans that are sitting there. We have their boxes of teeth. They cannot get the chart information from United Way. He's struggling getting that information, but he has agreed to finish those cases. After that, we have about 311 veterans on the wait list. I have that wait list still chronologically in order when they called to get into the program. They were waiting for their spot to open in the program. Those 300 and some veterans have nowhere to go now. I don't know if that helps.
So the one thing I can tell you is they didn't just care for veterans for Grand Traverse. From the Sioux to...
We had one guy from...
Yeah, I mean, they covered veterans from all over, not just our veterans. So it was a huge gap filler for sure. Now, I can tell you, and Mike can speak more about their clinic, but I can tell you when I partnered with them before Dental Clinics North, they do some work, but they're going to have to refer out some other stuff that we would have to pay, you know, $2,500 if it goes to someone else and get fixed and then go back to Dental Clinics North. Now, can we look at in the future the $12,000 we were donating to them and go, we're not going to spend that if a veteran comes in and applies and then goes to Dental Clinics North, or we work something with Dental Clinics North? Absolutely. We could absolutely do that, and we still wouldn't be spending the $12,000 a month. But the free services to the veterans and the other things that came along with the community, you know, our mobile service unit was sitting there every Friday, so if a veteran needed any other veteran benefits, they could go out to the mobile unit and talk to someone right then and there before or after their visit. So I mean, it was a team effort. So, do you have anything you want to add, Mike?
And we also had a food pantry. We had lactation classes, parenting classes. I mean, the dental center was a huge community asset that helped people more than just teeth.
Good morning, Mike Leahy, Health Department. The answer is no. So when we first met with United Way, United Smile, United We Smile, when we learned of the venture, so we partner with Health Department Northwest Michigan to operate Dental Clinics North. I think they have 14 offices across the Northwest region of the state of Michigan. When we talk about needs assessments in communities, and we talk about gaps in services related to mental health and some of those items, dental services is even more of a critical need. And to the group's point here, this was a very niche market that was being met there, a very specific service that Dental Clinics North has a list out the door and for those to seek services. So that gap, from my understanding, is not going to be filled at this moment. And you know, I don't envy you guys. Dental clinics are very expensive to run. The services of dental work is very expensive, and you know, when you said revenues, right, it's tough, right? Like grants are revenues. What is revenue, and how do you weave that together to create a sustainable delivery of service? So just kind of hearing some of this now. Don't know all the details. I don't know if they're mine to know. But there is going to be a gap in our community, and that's not just our Grand Traverse community. We see folks in our building that come from all over the region who are on a wait list for DCN. So,
Thank you. Well, thank you for being here today. It sounds like you guys got some work to do. I'm hoping to hear from you. Good luck, Mr. Roof.
Okay, thank you.
Thank you. We're going to take a 10-minute break. Guess not. We're going to call this meeting back to order at 10:42. Commissioner Andrews?
Yes, thank you, Chair. My brain is sometimes a little slow and absorbing a lot of information related to the United We Smile Challenge, but at this point, having had just a moment to take a moment and think about it, I'd like to tie this up with the next step and not just leave it as presented. And I'd like to make a motion at this point that the board direct Administrator Alger to work with Mr. Roof and Mr. Leahy to collaborate on possible options to continue providing the services that United We Smile provided to Grand Traverse County residents and bring them to our board for consideration.
Support.
All right, we have a motion by Commissioner Andrews, support by Commissioner Morris, to direct Mr. Ruff, Mr. Alger, and Mr. Leahy to work on a plan. To summarize, Commissioner Hensel.
I just want to thank Vice Chair Andrews for bringing that up. I think we all sat here just astounded and devastated at the loss of a service to our veterans who are very near and dear to our hearts in Grand Traverse County. So thank you. It was a good time for a break so we could kind of process and, okay, how do we as a board act? How does the board deal with this? So thank you for that.
I concur. No further comments? All those in favor say aye. Aye. All those opposed say nay. Thank you, everyone. So now we're going to go to unfinished business, 9A. Mr. Alger, could you set this up, please?
Yes, thank you, Commissioners. During the Agenda Setting Committee, we were asked to, we get these updates routinely from the Homelessness Task Force, and one of the updates that recently come was the November-December update. We also have some public feedback sessions today that we felt it appropriate that Ashley and Christy come today to update the board, answer questions that you may have, and then kind of push a shout out for the feedback sessions today. So, Ashley.
Okay, thanks. Thank you all for inviting us to be here today. I'm Ashley Halliday-Schmandt. I'm the director of the Northwest Michigan Coalition to End Homelessness. Today, like Nate said, we're here to provide a brief overview of the task force work over about the past year. And then end with some of the recommendations that are coming out of the work groups, and then invite the public to attend our public feedback sessions this evening. So I have about a 15-minute presentation. Hopefully we can do questions and stuff at the end so I can get through it. It's a lot. It's a year's worth of work, so it's a lot of content. I also wanted to say that we, thanks to Christy, have a beautiful website. So anything I miss or you want to know more about is on that website, full of content. It's housingandhomelessnesstaskforce.org. So you can find everything there. And I wanted to start just by another thank you to the board for appointing Nate to be on our task force leadership team. Nate has been wonderful, both as a thought partner and just as a partner in this work as we learn together. I'm learning more about county like funding allocations and procedures, and he's learning more about our work, and it's been really great and meaningful. So thank you. So I'm going to divide the presentation today into 3 buckets. One, just very briefly, because as Nate said, you've been receiving monthly updates along the way. I've already been here once also to kind of talk about the why, but the first bucket being the why. How did we get here? Why is there a task force? Second bucket, the how. So like, how did we form it? What was the structure? What were the decisions around the structure? And then finally, the what. So what did the work groups do? What is going to be coming out of the strategic direction? So we'll get started with the why. Not to dig into any of this too deeply, but really it was a problem of a very complex community issue like homelessness. Takes a lot of stakeholders and a lot of partners to do something that's very difficult, and in a community, everybody kind of has a part in it, right? And so providers were kind of going at it alone under the coalition, but we were still operating a homeless response system, very separate from local government. In some communities, they do that a little bit different, where the homeless services are really embedded within the county or the city. So we were doing that kind of on our own. City was doing some things on their own. County was being extremely helpful as well, but still doing things on their own. And what that created was this climate of reactionary. So it was very reactionary. If something came up, maybe we'd put money towards it and come to you with an ask, but there was no strategic direction. And so out of that came lots of community concern from our partners, our stakeholders in our neighborhoods, in our communities, and from you all as well. And so we decided, okay, a task force to really nail down a strategic direction to address and end homelessness is needed in our community. Task force goals, not going to go through all of them. Most importantly, to develop that unified strategy to address and end homelessness in our community. As we were thinking about how this task force would get formed, who would be on it, what would we work on, these are some of the important questions we considered. Really, the big thing here, let's not duplicate let's duplicate work that's happening well in our community, and let's look at other communities who have done this successfully and enhance what they've done, adapt that locally. Also, what opportunities are we overlooking? What are strengths and kind of some partners who haven't been at the table yet in this different way? How could they contribute to this process? And then finally, what will we expect to see in 3 to 5 years in our community if we're successful? Now we'll go into that second bucket, the how. So this is how things have existed over the past year. This is the task force structure. I'll start at the top. We have our task force leadership team, which is Nate serving on, Benjamin Marentet from the city, myself, Christy Minervini, our task force coordinator, Sakura Takano of Rotary Charities, representing philanthropy, and then Ryan Hannon from Central United Methodist Church, representing just as a subject matter expert on that leadership team. Our Task Force Advisory Council was made up of the leadership team, working group chairs, which I'll introduce to you in a second, and then other community leaders who have a big role to play in the efforts to end homelessness. And then finally, we have our working groups. Working groups were made up of folks on the ground who are subject matter experts in their particular field, and mainly service providers. The working groups we thought were most beneficial to developing the strategic direction were Safety Net Services, focusing on not so much crisis management, but basic needs and prevention of homelessness. What can we do for folks while they are experiencing homelessness, and how do we enhance those efforts? And also, how do we go a little bit upstream and prevent it from ever happening in the first place? Emergency Shelter and Services, pretty obvious in the name, focused on emergency shelter and day shelter services. And then Housing Solutions, focused on the development of enough deeply affordable housing to meet the need in our community, as well as the support services attached to that housing to keep people in housing once they leave homelessness. Here's our timeline. This has been adjusted ever so slightly. As I'm sure you can appreciate, this was a very complex issue with many stakeholders along the way. So again, all of this is on our website. I won't go through all of this, but here we are in January giving updates of where we're at, holding public feedback sessions actually this evening on some of the recommendations that are coming out of the plan. And then in February, we will finalize our work and present to you a strategic direction. More on the how. This was our meeting schedule over the past year. Over 40 meetings have occurred with community partners and leaders. Something I want to highlight here were our listening sessions. We held 3 listening sessions over the course of the year with people with lived experience of homelessness, one at Central United Methodist, one at the Goodwill Inn Emergency Shelter, and then one at Jubilee, or 2, I think, at Jubilee House. Nope, 1. And those were talking to folks currently experiencing homelessness in our community, both getting feedback on some of the work coming out of the work groups, as well as just, what are the needs? What do you see the needs are? What can we be doing better? What's working, what's not? Although our meetings and the entire task force was not open to the public to attend all of our meetings, we were committed to inclusivity and transparency all along the way. And these are just some of the ways in which we did that. So again, everything that you could ever want to know is on the website. We were giving city and county commission monthly progress reports. Those were also made public in the packets. Regular updates to you all, one-pagers, for work groups and advisory councils every time they met, or brief presentations every time they met on kind of where we're at, and then finally the task force overview document that everyone received. Here's a lovely picture of our leadership team. Also want to highlight Rick Bellingham. He is a volunteer in our community, wealth of knowledge, and he has helped us facilitate this process along the way. So very appreciative to Rick. All right, now let's dig into the final bucket, the what. So what have we been doing? These are the working group co-chairs. So each working group of this task force had 2 co-chairs. Safety Net Services was represented by Jennifer Holm, City of Traverse City Police Department and the Quick Response Team. Bailey LePan, who is the Director of Outreach for Goodwill Northern Michigan. Emergency Shelter Services was co-chaired by Dan Biron, Executive Director of Goodwill, and Pat Livingston, Board Chair of Safe Harbor. Housing Solutions chairs were Becca Binder, former Executive Director of Northwest Michigan Supportive Housing, and Carl Fulmer, Traverse City Housing Commission Director. Each work group was tasked with coming up with recommendations that would inform this strategic direction. What we really wanted to happen was to have the recommendations filtered through this recommendation funnel to ensure that they were data informed and achievable by our community, first and foremost. So every time an idea came up or a recommendation was brought forward, we'd take it through this recommendation funnel. So is it achievable in this community, data informed? Does it align with the values of the task force? Is it rooted in housing first principles that we know to work to end homelessness? Does it leverage partnerships without harming anyone? And by anyone, I truly mean anyone. I mean community members, I mean the people that we have the privilege of serving in our homeless response system, and providers. Will it benefit multiple stakeholders, and are the outcomes measurable? So everything that you'll see in a second when I get to recommendations was taken through that funnel. In addition to the funnel, it also, we decided to develop a recommendation template for every single recommendation. So the work groups filled out this template. What does it mean in practice to actually pursue this recommendation? What's already in place? What are the gaps? What steps would help implement this? And what would success look like? So this exists for all 14 of the recommendations I'll share. All right, I need a drink before I get into that. Okay, Safety Net Services. So again, like I said, Safety Net Services focusing on preventing homelessness and addressing the needs of people currently experiencing homelessness. There are 4 recommendations. I will just briefly go over them. I'm not going to go over like the entire why this matters and what the goals are. Again, you can find all of that on the website. So their first recommendation, ensure equitable community outreach with, in coordination with street outreach providers and the quick response team to expand coverage of the quick response team and street outreach to the entire county. Second recommendation, integrating trauma-informed practices and resilience fostering approaches across the homeless response system to prevent returns to homelessness. Third, increase access to mobile health and mental health services, including mobile med, and the crisis center, and that would really create a model for regional implementation of the mobile medical unit. Fourth, invest in upstream prevention and early detection of high risk of homelessness while supporting programs that help people maintain housing stability. Sorry, there were 5. Fifth, improve homeless response system navigation and service coordination. And this one really just speaks to something as homeless service providers we always need to be doing, always need to be looking on how to improve and serve our constituents better. All right, next, housing solutions. Housing solutions work group was actually broken out into 2 subgroups, one focusing on development and the second focusing on support services. And something really cool that happened along the way, we thought, oh, these guys don't want to talk to each other, right? So we had the service providers, people, counselors, social workers on the ground working with folks in the field, and then we had developers in the same room, and we thought, oh, we'll split them up and they can come back together at the end. And actually in 1 or 2 meetings, they chose to come together and really start having those difficult conversations about why it is difficult to build supportive housing. And then the providers got to talk about why it is difficult to support folks in supportive housing without adequate resource allocation. So it was a really nice melding together of 2 groups who don't typically talk to each other. So we'll start with housing development. Recommendation number 1, first and foremost, expand deeply affordable housing availability and development of permanent supportive housing. So permanent supportive housing is long-term housing for people who are disabled and experiencing chronic homelessness. And when we say deeply affordable housing, we're talking about housing for folks between 0 and 30% of, or making between 0 and 30% of the area median income, which is about $23,000 for a single household per year. Second recommendation, explore innovative financing mechanisms such as pilots tied to area median income, brownfield housing TIF, affordable housing millages, et cetera, to really drill down on the need for permanent supportive housing. Recommendation 3 out of development, advocate for increased density and zoning flexibility to support deeply affordable housing. And finally, adopt an incentives toolkit and developer checklists that consider homelessness and encourage deeply affordable housing during the planning stages. And then finally, our second recommendations, or our final 2 recommendations out of housing solutions, were to sustain and stabilize HUD-funded permanent supportive housing for 1 year while providers develop a long-term funding plan. And that was really in response to some cuts we were seeing at the federal level. And then second, expand access to behavioral health and integrated care supports for those residing in permanent supportive housing through the development of a comprehensive and integrated care team. And then finally, our last work group, emergency shelter and services. The goal of this work group was to improve crisis response related to having enough emergency shelter beds in our community and enough services in the daytime for folks experiencing homelessness. First recommendation out of that work group, create a sustainable budget and funding plan for emergency and day shelter services. Recommendation 2, develop a consistent set of recommended service standards across all emergency services and day shelter to ensure the highest quality of service. And then finally, I'm going to read this one verbatim. Maintain current year-round shelter operations in Grand Traverse County while planning for shelter consolidation with key partners such as Safe Harbor, Goodwill, and the Community Cares Coalition for 24/7, 365-day operations with 165 beds. Likely, the most feasible option at this time is Keystone Road. If that proves not feasible, we will look at other options, including a new location or adding 30 beds at Safe Harbor. Those are the recommendations. The leadership team is still working through a prioritization process for all of those 14 recommendations. Last week, we met to start to prioritize them, and we used, to do that, or the first step in doing that was to use an Eisenhower matrix to determine the importance and the urgency of each recommendation. And this is how that shook out. So at the top, I don't think it's a surprise to anyone in this room, most important and urgent is to develop a consolidation strategy and funding plan for emergency shelter. I'm kind of grouping those because they'll happen together, and they rated just about the same. To stabilize our permanent supportive housing is next. That's very important because without that funding, we are at risk of seeing even more people fall back into homelessness who have been housed for a very long time. Expand permanent supportive housing and deeply affordable housing is next because that is what ends homelessness. We need to build enough shelter space in our community to meet the need while at the same time developing enough housing to get people out of homelessness permanently. And then, I mentioned the pilots a little bit earlier, and then finally, pilots, TIF, millage, that stuff will be more policy related, and then finally the integrated care team for folks in permanent supportive housing. Not every single recommendation will be coming before you or the city or the community to adopt. The leadership team, like I said, is working on priorities right now. We're in the final phase. All of the work groups are wrapped up. All of the advisory council meetings are wrapped up, and things are sitting with the leadership team in terms of priority and then resource allocation. From there, we will return to the county and the city to formally adopt the recommendations. And those, like I said, will come out of the leadership team. And then tonight, we have 2 public feedback sessions, one at 2 o'clock, and one at 6 p.m. in the basement of this building, of the governmental center. And that's for the public to really, for the first time, engage with some of the recommendations, just like we're sharing today. And then finally, our next step. So I already talked about the leadership team working on funding priorities and resource allocation. It's really the most important part of this work right now. The strategic direction document that will come out of the task force will be available in February. And then comes the implementation plan, and that's where leadership will work directly with you all and the city commission as well to develop that roadmap to track progress and measure impact around implementation. And that's all I have.
Any questions? Commissioner Walter.
Thanks for being here. A few things I'm a little confused about, so hopefully you'll help me out here. Says that the public input sessions that are scheduled for today at 2 o'clock and 6 o'clock are related to updates on a potential Code Blue policy. And I don't know what that means. Is it that, which I don't know what that is, or is it a public input on what you presented here?
I can tell you what Code Blue means. I think that was an oversight. That's not meant to be in there. Code Blue is our community's response when it reaches below 20. When the temperature is below 20 degrees, we have a plan in place so folks are not walking around outside, that our shelters remain open. But that is not the focus of this tonight. I'm sorry that was included.
Okay, so the public input sessions are requesting public input on this plan.
The recommendations, yes.
Okay. And I'm a little confused on the timeline because if I go back, or maybe you can bring it up. If I go back to the calendar, something like budget and specifics were coming in like August or, yeah. And so are we just a few months behind, or is
we
this, like, can you speak to kind of really where we are with this plan and what is coming next?
Sure. Yeah, I think we were pretty ambitious in the beginning that we would be able to get through this a little bit quicker, and we just weren't. So a couple things happened along the way. One of the things that I'll speak to a little bit, I'm sure there's more questions about it, is the plan for emergency shelter in our community and what happens with Safe Harbor, Goodwill, and our partnership with the Task Force and Community Cares Coalition. That is a little bit more complex than just creating a budget and saying, hey, providers, do X, Y, and Z thing. We started that work, I believe that started, the process of creating a budget did start in the summer, and things started to progress. And then we talked about what would it look like to consolidate operations? Is that a cost savings for our community? Why do we have two big shelters, one in the middle of downtown, one out in Garfield Township? And so we started to look at, okay, it might be a cost savings to consolidate. Well, then when we think about consolidation, there are many, many, many thousands even, if you count Safe Harbor volunteers, of stakeholders involved in that process. And Safe Harbor and Goodwill felt like they needed more time to socialize that with their boards and their constituents. And they took some more time in the early fall to really talk about that with their leadership. And so now where we're at, with the budget for that, or for emergency shelter, is working to hopefully, in the implementation stage, engage a consultant to come in and help through that. It's proving to be a little bit more complex than just creating a budget and presenting it to the boards. But budgets for other items like permanent supportive housing development, integrated care team, I'm trying to think what else would require a budget. Everything else we have, it will be included in the strategic vision.
So what we got in our packet is a little different than this in terms of the recommendations. And I'm just wondering, like, is the public response, like, what is the exact document that we're asked to respond to, or that the public is, like, you know, what's the input session about?
What's different? The recommendations were different?
What is in the packet, Ashley, is the November
Thank you. Yep, so we report, your monthly reports are like we get those out mid-month of the next month. So it's a little bit behind, it's not like live information. The information that's on here is live. There was some rewording of a couple things, but by and large, it's very similar in terms of recommendations. But the public will be asked tonight to respond to the recommendations.
Mr. Spence.
Yeah, thank you. Thanks, Ashley. So the task force is winding down, and then the different leadership teams will then regroup and come up with an implementation plan for each of the different leadership groups. I'm trying to get a better visual of how this all works after the task force is finished with their recommendations.
Sure. So the working groups, those three you see across the bottom, and the advisory council are done meeting. The only group continuing to meet is the task force leadership team. And that's been made transparent to the working groups throughout the process, that you are coming up with recommendations, but it is the leadership team who is the decision maker around what actually gets implemented and goes before the boards or funders for funding allocation. So the work part for the working groups is done and complete, and it's sitting with the leadership team right now to prioritize what recommendations move forward.
Okay, and then with them, we'll see their implementation plan and their timeline and how it all is planned.
That will
to
come next.
together.
So what will be delivered in February is the strategic vision. So that will be all of the recommendations approved by the leadership team. We might not have the budget for emergency shelter at that point. That we'll have a rough estimate, but that's still being worked on. But in terms of everything else, anything that gets recommended will come forward with a budget. The next step after that will start a new phase of implementation.
Thank you.
Mr. Andrews.
So to make sure I think I understand this, there are currently 14 recommendations. I believe 6 of them scored high. Excuse me, I think it was called an Eisenhower chart. Yep. The leadership team is going to prioritize some, but not all of these 14, and we will probably see the ones that scored highest move forward. The
Yes.
rest will not be in.
I mean, they'll be in the strategic vision. It's really, they'll be kind of included in the plan. Will they be recommended? I mean, some of them don't even need funding allocation, right? Some things providers can just accomplish by working together better. So everything will be mentioned in the plan. Will it be recommended for funding or for anyone to really, at the funder level, to do something about? No.
So once the task force has a final report that includes its priority recommendations and the basis behind them, that will come to the funding boards, which is City and Grand Traverse County,
Yes, and philanthropy.
and then the task force is done?
The task force, as it was, is done. We'll need to form, and that's what we'll be talking about in leadership as well. What does the implementation team look like?
And I guess that's where I'm going, because to just ask the funders to develop an implementation
No.
plan seems not functional.
No, sorry. Sorry if I
So
said it,
one of-
that's not the intent, no.
So the recommendation would be to create another group going forward to develop the implementation plan?
To oversee the implementation, I mean, the implementation, I mean, it will depend on what of these actually goes forward. This is all we have at this point in terms of the prioritization. I shouldn't say all, I mean, this is a lot of work. This is a year's worth of work, and a lot went into discussing the importance and urgency of these. Next will come priority around funding. So I think implementation, a group will be developed out of the leadership team to move it forward. And I'd like to see what I envision, this is my opinion, what I would like to see with the implementation is a level of oversight from the county and the city in partnership with the coalition at that time.
How do you prioritize recommendations before the costs? And how do you, right, like some projects will cost $3 million a year. Some
Yeah.
projects will cost nothing. It will just be intentional action. How, and we don't know those costs, right? So
The only one we don't know for certain, and we have estimates, we just don't know for certain because we haven't done it yet in our community, is the emergency shelter consolidation, if that were to move forward.
So the final report will have costs associated, for example, with a countywide QRT,
If that was prioritized, yes.
but we won't put a cost on it unless it's prioritized.
I feel like Jen probably has an estimate if that, some of these have not been prioritized, not because of funding, but because of urgency and importance. So there's a difference. There's, right, if something isn't even coming up in the top 20% because people don't feel it's urgent and important, we're not going to spend a lot of time around developing a budget for that because we know that it won't move forward.
Anything else? Anybody else?
I don't know if anybody asked, I'm sorry, I had to step out for a second. Is there a budget for how much it would cost to, oh, did he? Oh,
No.
No.
There's not, okay, that's all, sorry, I missed it. I won't say it.
For
I'll ask it
what?
again then.
For what
though?
specifically?
For housing or
Yeah,
3 more
there's,
beds or.
we do have budgets associated with, we're not here to present that today.
No, I understand.
But yep, we do have a budget. The only budget that we do not have 100% firm is the consolidation of emergency shelter. The rest of the things that are on the top of this, we do have budgets for.
Okay.
Is that number 1 or number 2 or number 1 and 2 combined?
I think it's 1 and 2 combined. I mean, I can tell you where we're at right now. The emergency shelter work group is no longer like working necessarily as part of the task force, but they have decided that they want to engage a consultant to come in and help work through what it would look like to consolidate shelters at that proposed location. That is something that is very, very difficult and complex and will have lasting impacts in this community for a very long time, and it's not something to take lightly. So we have developed some estimates on what that could look like. We are not all the way there, and that needs to be validated, in my opinion, by our partners at the national level.
So if it comes back, whatever, the consultant will do their work for however many months or whatever that is.
It's 6 weeks.
Okay. And bring back their recommendations, and what if they say it's not feasible, then are we kind of back to the drawing board in terms of the sustainable shelter and the funding plan?
That's why that sentence is in there. That's not necessary, that is not the intent of the work group to explore several other options. The intent of the work group is to engage a consultant around validation of what we've already come up with as a work group, which is the first part of that, which is shelter consolidation.
Okay.
So in your last report we got, there is a small percentage of folks that you're servicing that are not from this area. I don't see anywhere where we're trying to find those folks to get back to where their homes are and use their support services. I see Alpena here last week starting a pilot program called Finding Your Way Home. Has that been discussed at all or been prioritized?
I'm not familiar with that program, but that happens already within the homeless response system. So we have a program called Diversion. Diversion workers go to Safe Harbor. They're embedded within our call center and Street Outreach and the Goodwill Inn, all the places that people experiencing homelessness go to first, and they work directly with them to get folks back to where they have more resources. Problem with it, like I can't, put gates on our community. This is just something that happens with regional hubs. We're very lucky that it is as low of a percentage as it is. But yes, we've made efforts. It's not something included in this plan because we're pretty successful at it as a homeless response system already.
Fantastic. I didn't know that. Thank you very much for that.
You're welcome.
Commissioner Walter.
Yeah, sorry, I just want to go back to what, just so I can understand the direction with the consultant and next steps related to, sorry about that, shelter consolidation. In the document that we have, it says, maintain the recommendation, maintain current year-round shelter operations in Grand Traverse County while planning for shelter consolidation with key partners for 24/7, 365-day operations with 165 beds, noting the Keystone Road as the most feasible site. If infeasible, alternative options such as a new location or adding 30 beds at Safe Harbor were considered. So the consultant is being tasked with just the consolidation on Keystone project, or are they also looking at those alternative options? Where, just so I understand what's happening next.
Sure. Well, they're not engaged yet, so I do want to, we are still working as a group. We just met a couple days ago. We're still working to finalize what that proposal would actually look like and what that scope of work looks like. So hopefully by early next week, we'll have some more updates on where we're at with the consultant. But like I said, it's not to explore every option. It's not as if the consultants will be asked to come in and say, here's a piece of land, let's do that. It's to validate what the work groups have already recommended. So the recommendation is as it sits. They will, as part of this, look at Safe Harbor as an emergency shelter. They'll also look at Goodwill Inn as an emergency shelter. But it's really to validate that that work of, does consolidation make sense? This is the most viable land that the work group felt met everyone's needs, including the people we serve, to the best of our ability, and it will be around validating that.
So if there are no more questions, comments, Mr. Alger, you were going to say something?
I would just like to add that that recommendation did not come quickly nor easily. We had a very, I felt, very good discussion at the last advisory committee meeting where people coalesced around the recommendation, and the humility, the caring, the passion that was involved in that recommendation is significant. They know that potential move to a different location presents challenges. We first start with the respect and admiration for those that have provided those services at Safe Harbor for decades, and recognizing the value that's associated with that service. So it was a challenge, but they did get there, and it was nice to hear from the work group leaders, especially like Dan Baran and Pat Livingston, that we're all on the same page that this is the recommendation.
Yes.
This is the direction that we want to go. And, Pat was very good at saying, this is the why. Why are we moving, potentially moving a population of those that need services to a different location? And he has reasons. And I think that in the future, Pat would probably like to talk about those reasons. And Dan Baran from Goodwill, he also recognizes the benefits associated with consolidation, but there are challenges with each one of those options. So tonight will be valuable. Today and tonight will be valuable to hear people's perspectives on the recommendations and understand from a community standpoint, what are your thoughts on this? And then come back to this board and present those, all of the options and recommendations and costs associated with them. So.
Thank you for your time today.
Thank you,
I look forward
guys.
to seeing you in the future and what you guys come up with.
Thank you, guys.
So we're going to move along. There is no new business. So Commissioner administration reports. I'm going to start right with you, Commissioner Henschel. Got anything?
Nothing today, thank you, sir.
Mr. Spence.
I serve on the Beta board, and we're still in need of our additional Beta board member, and I'm not sure where we are with that. I did look at our website, and I see that applications are still being accepted for some of our various board vacancies, but I'd like to make some forward movement on that. And also, the Silver Lake drain needs to be cleaned in the next few months, and I feel like as a representative of Garfield Township, District 4, and Blair, that still hasn't been resolved is who's going to clean up that vegetation. So I'd like to consider that in some of our future meetings.
He did decide to give that to Drain Commissioner Andy Smits to come up with a proposal to clean that. So that is being worked on as we speak. That's his job. He's doing it. As far as the other thing, I don't know. Who was they at? Weren't you the chair on that for the Beta?
Yeah,
Is that coming? Do you know?
I have no idea.
Joe Underwood applied, but he was like the only one.
No, there was another one, too.
Oh.
There were 2 applicants.
Okay.
We wanted to bring back Beta for more consideration.
Perfect. Is that all, Commissioner?
Does the current, I'm sorry, does the current appointee on Beta serve until a new one's appointed?
Yeah.
Okay.
No.
That is not
I
what.
don't think
That is
so.
not correct.
That's not what we discovered.
Okay.
The term ends when the term ends. There are a few boards that are statutorily required that may be a requirement, but the Beta board is not that.
Okay.
There's nowhere in the Articles of Incorporation bylaws or our board rules.
So, quick wrap-up on, I'd like to bring our drain commissioner in for a work study, part of a work study if possible. There's some contracts that need to be renewed, and there's some compliances that need to be updated, apparently.
I believe that's going to be scheduled for the next meeting. No? 2 meetings out.
Thank you, that's all I have.
Thank you. Commissioner Flynn?
I do not have anything at this point.
Mr. McAllister?
I have something. We have a meeting tonight out in Green Lake Township with our area business folks from TCH, Okies, Randy from Blue Vase, Jeff from Tom's and the Hofbrau, and we're going to talk about what we can do since we're lucky enough to get a roundabout, which is like 25,000 cars a day that are going to go around Green Lake Township, and how the area business people can actually survive another gut punch. So we're going to have a conversation at 5:30 at the library if anybody's interested or has some ideas on what we can do to help. I hear Rob Henschel has some ideas. Since his road's been closed down multiple times, and we would welcome some input.
I look forward to the findings of that.
Have a big savings account. You're going to lose your tail.
Oh, well, I thought MDOT would fund it or something.
Yeah.
No?
caring.
Okay, just checking.
Commissioner Walter.
Nothing, but I just wanted to follow up real quickly. Could you all send us what you presented? Okay, because we have,
I already have it. I asked Lisa for it while she was presenting. I can just forward it to you all.
awesome, thank you.
Mr. Morris.
Commissioner Spence actually reminded me, we do have some terms ending on Northern Lakes Community Mental Health Board pretty quickly, so I would also like to see some forward movement on those ad hocs. Thanks.
Duly noted. Commissioner Andrew.
Nothing for the group.
I have nothing to report for my districts, but I'm going to apologize to County Clerk Shealy ahead of time, but I want to do a couple of shout outs. I'm stealing your thunder, Bonnie. For one, we had a countywide training for employees on Martin Luther King Jr. Day, and as I'm sure you all well are aware, the weather was awful. I was blessed to have the opportunity to speak, and then that started, and it was a well-attended event. There was way more people there than I thought were going to be there due to the weather, and I'd like to say thank you to them, because they are the team that makes all this work, and also to County Clerk Shealy and her office and her staff, as well as to Register Deeds Rokos and his staff, because while we were having training in the inside, they were moving their offices through the weather, through the snow, on the outside on Monday, and it was unbelievable. They would shovel a path, then the path would be full by the time they came back for another load of records, and it was a Herculean effort, and I think they should be recognized for that, for doing that. And I appreciate that as a taxpayer, for you guys to do that on your day, on your quote-unquote day off. Other than that, I have nothing. Mr.
And
Allen?
I would like to add to that, it was, yes, the clerk, the register of deeds, and the treasurer, they were very flexible in discussing how to make the move. We've been talking about it for quite a while, plan after plan, but it was also IT and facilities. They had to dive in and make all of that work, and ultimately, teamwork makes the dream work, so to speak, and they really did work hard to get to that point, so here we are, and that's going to be about a 6-week period of time, hopefully it's a little less than that, where we can have that side of the building renovated. Also, Lisa did text me, she's accepting applications until February 6th for Beta and for Northern Lakes CMHA. And today is the last day for registration for the gala. If any of you choose to attend, please let us know.
Is there a recess coming up?
Yes,
Yeah, it's today.
it's not today. It's, is it today?
I think it's,
Well, it better not be today.
no, it's the first Wednesday, isn't it?
Well, it's supposed to, I don't think it's the first Wednesday this time. It's at the airport. I can tell you.
February, I think.
Yeah, I
Yeah,
think it's in February.
Which is
That
coming.
recess will be at the airport, so, yes.
Yeah.
Yeah. It's at the airport. Anybody else?
No.
Care to share?
2 weeks from now.
No? All right, so second public
I
comment.
have a funeral.
Anyone care to come to the podium at this time? Going once, going twice, 3 times? You're out. We're adjourned, ladies and gentlemen. Thank you so much for your time today.
Thank you.
I didn't see IT up.